Minnesota is making waves in the national health debate by defying federal guidelines on COVID-19 vaccinations. But here's where it gets controversial. The state's top health official, Dr. Ruth Lynfield, has issued a standing order allowing pharmacists to administer vaccines to a broader group of people than what the federal government currently recommends. This bold move flips the script on years of aligning with FDA and CDC protocols, raising questions about who should set the rules for public health in an era of scientific uncertainty. And this is the part most people miss. The decision isn't just about convenience. It's a direct response to a federal advisory panel now led by vaccine skeptics, including Robert F. Kennedy Jr., who recently reshaped the CDC's guidance to prioritize individual choice over universal vaccination. Could this be the beginning of a nationwide clash between state autonomy and federal science? Let's break it down. The core of Minnesota's new policy is simplicity. Pharmacists can now give COVID-19 vaccines to anyone aged 12 and older without a prescription, regardless of age or health conditions. Previously, only those 65 plus or with pre-existing conditions could access the shots this way. Lynfield, the state's epidemiologist, explained the shift was driven by a desire to make it easy for Minnesotans to go to a pharmacy during a critical respiratory disease season. With 46% of all vaccinations in the state already happening at pharmacies, this expansion aims to boost coverage. But critics argue it's a risky gamble, especially when federal advisors, now under Kennedy's influence, have stopped recommending vaccines altogether. So why is Minnesota pushing back? The answer lies in the data. Despite declining pandemic-era fears, the state still recorded over 3,500 hospitalizations and 320 deaths from COVID in 2025 alone. Studies, including one by Health Partners, show vaccines reduce ER visits by 33% and hospitalizations by 40% in seniors. Yet federal guidelines have stalled, leaving states like Wisconsin to follow Minnesota's lead. Meanwhile, medical groups like the American Academy of Pediatrics continue to endorse broad vaccination, calling it a public health imperative. But what about the risks? Complications from vaccines are rare, but not non-existent. Cases of myocarditis, heart muscle swelling, have been reported, though studies suggest fewer than 4 in 100,000 recipients. Even Dr. Gregory Poland, a vocal vaccine advocate at Mayo Clinic, admits he experienced tinnitus, ringing in the ears after his shot. Still, researchers from the University of Minnesota emphasize that the vaccine's benefits far outweigh these rare side effects. This isn't just a Minnesota story. It's a test of whether states can, or should, take the reins when federal science becomes politicized. As Governor Tim Walz argued, we can't let fear of controversy stop us from protecting lives. But here's the question that keeps coming up. Should states like Minnesota be allowed to override federal health policies, even when those policies are based on evolving scientific consensus? Share your thoughts in the comments. Do you trust state officials to make these calls, or does this set a dangerous precedent? The debate is far from over.